ናችሁ? You can't listen Amharic, you will get the English version of my speech later. So I kindly ask you to make my speech in Amharic because we are here in the center of the region. በቅድሚያ ጥሪ የተደረገላቸው እንግዶች ክቡር ዶክተር መሳይ ብዙ ኮሚትመንት ያለባቸው እዚህ ድረስ በመገኘት ፕሮግራማችንን ለመታደም መጥተዋል። ክቡር ዩኒቨርሲቲ ፕሬዝዳንት፣ የማኔጅመንት አባሎች፣ በአጠቃላይ ተመራማሪዎቹ በሙሉ ይዘው ነው የመጡት። ሌሎች ቢሮ ኃላፊዎቻችን የተደረገላችሁ እንግዶች ከፌደራል የመጣችሁ መምሪያ ኃላፊዎቻችን ከተለያዩ ጤና ተቋማት ክልል ውስጥ ካሉ ዩኒቨርሲቲዎች የመጣችሁ ሁላችሁም ክቡራንና ክቡራት ዛሬ በዚህ ፕሮግራም ላይ ተገኝቼ ይህንን መልእክት እንዳስተላልፍ ስለፈቀዳችሁልኝ እጅግ አድርጌ አመሰግናለሁ። በመቀጠል ዩኒቨርሲቲዎች የተቋቋሙበት አንዱ ዓላማ በሪሰርች ህብረተሰቡን ማገዝ ነው። ህብረተሰቡ ውስጥ ያሉት ችግሮች ምንድን ናቸው? የት ላይ ነው ያለነው? ምንድን ነው የሚጠበቅብን? ለእነዚህ ችግሮች ደግሞ መፍትሄያቸው ምንድን ነው የሚለውን የሚያስቀምጡ ሲሆኑ እኛ ደግሞ በፖሊሲ በምናወጣው በኩል ያለነው ደግሞ እነሱ የሚያወጡትን እነሱ የሚሰሩትን ሪሰርች በዚህ ሁኔታ ለህዝብ እናስተዋውቃለን፣ አብረን እንሰራለን። በመተግበሩ በኩል ደግሞ የበኩላችንን አስተዋጽኦ እናደርጋለን ማለት ነው። ሪሰርች መሰራቱ ብቻ ጥቅም የለውም። ጥናት ብዙ ጥናቶች ተሰርተው ሸልፍ ላይ ተቀምጠዋል። ስለዚህ አንደኛ የሚሰሩ ጥናቶች የህብረተሰቡን ችግር ያማከለ መሆን አለባቸው። ሁለተኛ ደግሞ የሚሰሩትን ሪሰርቾች እኛ ተግባራዊ ማድረግ አለብን። ያ ሲሆን በአንድነት ለውጥ ማምጣት ህብረተሰባችንን ተጠቃሚ ማድረግ ከችግር ማውጣት እንችላለን። ለዛም ነው ባህር ዳር ዩኒቨርሲቲ ይህንን ቅድሚያ ወስዶ ከጤናው ሴክተር ጋር በነገራችን ላይ ዶክተር ፍሬል በጣም ላመሰግናችሁ እወዳለሁ። ትልቅ የሆነ ኮሚትመንት ያላችሁ በጤናው ሴክተር በተለይ በጣም በቅርበት የሚሰሩ እና በዛ ውስጥ ካለነው ሰዎች ጋር እኩል በማሰብ የሚሰሩ ስለሆኑ በዚህ ልታመሰግኑ ይጠይቃል። ይሄ አብሮ የመስራት ልክ በሌሎች ዩኒቨርሲቲዎችም እየተጠናከረና እየሰፋ ነው። በተለይም ደግሞ ይሄ ወረራ ከመጣ ጀምሮ ብዙ ተመራማሪዎች ኦንላይን በማድረግ በእኛም በሴክተሩ ያሉ ቴክኒካል እውቀት ያላቸውን የላይፍ ኤክስፒሪየንስ የስራ ኤክስፒሪየንስ ያላቸውን አንድ ላይ በማምጣት ሰፊ ጅማሮች አሉ። እነዚህ ጅማሮች የምናጠናክርበት ላይ እያገን የምንሄድበት አንዱ የመጀመሪያው ፕሮግራም ይሄ ነው። ስለዚህ ለዚህ ትልቅ ፕሮግራም ሁላችንም አላደረሳችሁ ማለት ፈልጋለሁ። እዚህ መቅረቡ ብቻውን በቂ አይደለም። ስለዚህ የሚመለከተን አካል ሁላችንም ከዚህ የምናገኛቸውን ነገሮች ወስደን ከዚህ የምናገኛቸውን ፍሬያማ ውጤቶች የክልላችንን የህዝባችንን ሀገራችንን ችግር የሚችሉ ትልልቅ ነገሮችን እናገኛለን ብዬ አስባለሁ። እነዚህን በማድረግ አብሮ በመስራት በመተባበር ጤና ቢሮ ሁሌም ክፍት ነው። አብረን እንደምንሰራ ላረጋግጥላችሁ እወዳለሁ። አመሰግናለሁ።
Many thanks to Dr. Malcolm Abite for his remarkable speech. Now I call upon Dr. Masahailu, Director General of Ethiopian Public Health Institute, to the podium. For this audience, please welcome Dr. Masai.
ወንድሜ ዶክተር መላሙ አማርኛ ድረስ ማድረጉ ያው አማርኛ ለማስሙ የምርምር ማህበረሰብ ጥሩ ነው ብለዋል። በጣም እንደግፋለን። አጋጣሚ ስፒቹን ያዘጋጀነው ኢንተርናሽናል ኮንፈረንስ ነው ስለተባለ በእንግሊዝኛ ስለሆነ በትህትና እንድትፈቅዱልኝ ይጠይቃሉ። Your Excellency, Dr. Malkamu Abite, Head of Amhara Regional Health Bureau, Your Excellency, Dr. Frau Tegen, President of Bahar Dar University, Your Excellency, Professor Yeshigetao, Chief Executive Director for College of Medicine and Health Sciences of Bahar Dar University, Your Excellency, Belai Bezabi, Director General for Amhara Public Health Institute, dear Vice Presidents of Bahar Dar University, distinguished guests, ladies and gentlemen. On behalf of the Ethiopian Public Health Institute, I welcome you all to the official launching of this joint annual international research conference organized by Amhara Public Health Institute and Bahar Dar University College of Medicine and Health Sciences. I thank Amhara Public Health Institute and my brother, Belai Bezabi, for inviting me to make a keynote address at this important international conference. It is evident that several global health initiatives have been created over the last decade to support the delivery of available interventions for priority health problems. These developments have been accompanied by growing recognition of the role of research in improving health systems and healthcare delivery. Research has a crucial part to play in strengthening health systems and in improving the equitable distribution of health services. Thus, health research expanded and accelerated to build up evidence-based knowledge to improve the effectiveness of health systems. Operational, implementation, and health systems researches play a significant role in improving healthcare delivery system at all levels. Operational research is a research producing practically usable knowledge which can improve program implementation, such as effectiveness, efficiency, access, scale up, and quality. We are aware of the research and evidence networks play a significant role in realizing our Ministry of Health's vision to see healthy, productive, and prosperous Ethiopians. Collaborations and partnerships with universities like this are exemplary and are fundamental in realizing the mission of the universities and health systems because the initiative strengthens university-industry linkage, promotes the culture of evidence-based decision-making, enhance the development of health innovations and technologies, and strengthen community engagement and avoid duplication of efforts and resources. The Ethiopian Public Health Institute is a technical arm of the Ministry of Health is mandated to conduct surveillance for early identification, detection of public health risks and prevent public health emergencies through adequate preparedness, respond effectively and timely towards ensuring health security and contributing to building a resilient health system. The Institute also builds the capacity of the national health laboratory system to enable them provide quality laboratory services of international standards to properly support public health emergency management system, health services, public health and health-related researches, and provision of referral and reference laboratory services. Moreover, the Institute undertakes research on priority public health and nutrition issues, health and nutrition-related strategies, programs, and plans to generate and disseminate scientific information to improve the health of the general public. Our institute also has become the National Data Management and Analytics Center for Health in order to build standard data repository system, data analytic and synthesis capacity, conduct advanced analysis using multiple data sources, and produce scientific evidence for informed health decisions and facilitate evidence generation and knowledge translation. The Institute also supports regional public health institutes and health systems in conduct of operational research to improve the health care delivery system of Ethiopians. In addition to aforementioned roles and responsibilities, the Ethiopian Public Health Institute regularly supports the capacity building endeavors of regional public health institutes and regional health bureaus. Our institute also carries out various activities in producing scientific evidence, policy briefs, technical guidelines, and health workforce and diagnostic capacity development of regional laboratories. On behalf of the Ethiopian Public Health Institute and myself, I can assure you that the Institute work hand in hand and collaborate with Amhara Public Health Institute, Amhara Regional Health Bureau, and Bahir Dar University, as well as the research community to achieve our common goals to serve Ethiopia and Ethiopians. I finally extend my sincere thanks and appreciation to Amhara Public Health Institute, Bahir Dar University, College of Medicine and Sciences, the Amhara Regional Government, and the organizers of the conference, and all participants. I wish you productive deliberations and pleasant stay in our beautiful city, Bahir Dar. Thank you very much.
Many thanks to Dr. Masai for his outstanding and memorable speech. Now I feel so honored to call upon His Excellency Dr. Kurtageni, the President of Amhara University. Ladies and gentlemen, please welcome Dr. Kurtageni.
I think I'm challenged by the two speakers because they used two languages. So I have to choose, or I should follow a hybrid system. So, I prefer to address the officials in Amharic and communicate my message in English because there are people virtually. So I think we need to communicate. We say it is international, and it is indeed international. So we shall probably prefer to use English as a medium of communication, but it should not be obligatory. That people should have the right to choose. ይህንን ብዬ እንግዲህ ፕሮቶኮል ቅደም ተከተል ላይ ብሳሳት ያው ይቅርታ ይደረግልኛል። ዶክተር መሳይ ኃይሉ የዳይሬክተር ጀነራል APHI ወደ አማርኛ አስተርጉም ባልሳሳት ነው። ዶክተር መልካሙ አቡቴ የአማራ ክልል የጤና ቢሮ ኃላፊ፣ ክልሉ ፕሬዝዳንት በአጋጣሚ ምክር ቤት ስብሰባ ስላለ ስላልተገኙ እንደውም እሳቸው ወክለው እንዲገኙ ነበር የፈለኩት። ግን ክልሉ ወክለው ስለተገኙ እያመሰገንኩ ለተደረገልንም ሪኮግኒሽን እያመሰገንኩ ሪኮግናይዝ አድርጋለሁ። አቶ በላይ በዛብህ የAPHI ዳይሬክተር ጀነራል፣ የኔቲቭ አባላት ቫይስ ፕሬዝደንቶች አሉ። አንዳንዶች ውሃ ይጠጣሉ፣ አንዳንዶች ስክሪፕት ያውሳሉ። ቲሜን ይዤ ነው በትክክልም የመጣሁት። ኪኖት ስፒከርስ ሂር in person and virtually. I heard that Dr. Jonas Geda is also, Professor Jonas Geda is also one of the keynote speakers. Moderators, participants in person and virtually. እንኳን ወደ ውይይቱ ባህር ዳር በሰላም መጣችሁ ማለት ፈልጋለሁ። በአካል የመጣችሁ those who are following this international conference virtually, you should feel in way that Bahir Dar is a very beautiful, healthy city, a city recognized by UNESCO as a learning city because of Bahir Dar University and other educational institutions, a city considered as one of the healthiest cities in Africa, next to Cape Town and Kigali. So I hope you will be visiting us very soon. So, ladies and gentlemen, it's a pleasure to welcome you to this international conference. It's a joint health research conference. I'm happy to see, and especially for health. Health is a global agenda. And COVID-19 is a very recent memory that unless we do things together, collectively, we cannot survive, we cannot succeed. And there is also this concept highly promoted as a One Health approach. That also really reminds us that we need to jointly act, to jointly work together. As beginning, yes, we signed a memorandum of understanding. Unless there is action, it doesn't make any sense. And think that you have signed the memorandum of understanding in Lalibela, and that is a very holy city that you have ቃል ገብታችኋል ማለት ነው። ላሊበላ ላይ የተፈራረማችሁት። So if there is a failure in implementing, in sustaining what we are doing together, for example, Bala was mentioning that we didn't sustain the collaboration as the beginning when COVID occurred. So I think that is a very serious reminder that we have to sustain our joint efforts. And there is a very good reason that we have to work together. And we have, as we heard from Dr. Masai, as we heard from Balai, as we've heard from Dr. Malcolm, that we have a shared mission. And we are public institutions, that we are using taxpayers' money, that we shall not really unnecessarily and ineffectively use the resources. The resources include human resources. And as you heard my colleagues mentioning that in my field of study, for example, 60% of the master's and PhD holders are in the universities. Unless the research system uses this resource in the universities, it is wastage. It is wastage. So we need to work together for the benefit of the taxpayers as well. Today, we are talking about a very missing link, I could call, that there is hand, there is application or implementation on the other hand. And there is always either gap or overlap and all. So we are trying to fill that gap. Okay, there is a research in the university system. There is a research in APHI. There is a research in APHI. What is the use if it is not being used by the implementer, by the practitioners? So I think it is really the right way to organize, to jointly organize such a conference. And I'm happy to see also this motto of the joint conference, which is stated as evidence for health system resilience. It comes to the sustainability issue. There is this common mistake in the universities that every master's holder or every PhD in thesis defense is asked, what are the implications for policy? By the way, you can't have policy implication unless the research is designed for policy formulation. So if we are thinking about evidence-based policy formulation, it has to start from the design of the research. So I think this is the forum to check if we are really doing research for evidence-based policy formulation. Otherwise, it doesn't really make sense. Dr. Malcolm was mentioning about research probably on the shelf. It doesn't mean that every research can be used unless, as I said, it is designed properly from the very beginning for use. You heard the objectives of this conference, and I'm happy that, again, these are related to our missions, the universities, and the research institutions. It is about, well, those in research, you know, you can have applied research, you can have basic or fundamental research. And in a country like Ethiopia, which is a developing country, then applied research problem solving research is highly promoted, encouraged. That's what we can afford. It doesn't mean that we cannot do basic research. It means that we cannot do fundamental research. If we have the capacity, it is encouraged, yes, but priority is given for problem solving, applied research. But applied research, as I said, can be problem solving. Research can be done if the problem is properly identified. And it is one of the themes or the objectives of this conference that you are to identify like themes for research. Thematic areas, I checked. They are comprehensive. They are comprehensive. I'm happy that can only be possible by parallel sessions. I think it is organized like that. And many of these thematic areas are, if we check the strategic plan of the College of Medicine and Health Sciences, they are aligned with the centers of excellence we are envisaging to have. And that is probably a call for joint research on those thematic areas, which are the centers of excellence for Bahada University. So I totally appreciate the themes of the conference. In that sense, then I call upon our partner institutions here in Ethiopia and abroad to work together. I hope there will be a visit to our beautiful campus, College of Medicine and Health Sciences, Babagion campus, that we have a very big research facility building, which can accommodate any health-related research. And we are proud about the facility, but I tell you, I have to be frank, that it is beyond the capacity of Bahada University to efficiently use all the facilities, the rooms we have. And there is also another challenge that we have to equip that with equipment, the required equipment, so that we have research-grade laboratories. This is a call that we shall work together and use these facilities together for the benefit of the public. Finally, I thank the co-organizers, the institutions, the individuals involved, the organizing committee, that it is nicely organized and it will continue, I hope, in these 3 days. I wish you all the success in your deliberations, because the president of the region, as I said, is in a regional council meeting. I am asked to open this conference, so I'm happy to declare that the conference is officially open. Thank you very much.
Massive thank you to Dr. Ferro Teganye, the president of Bahada University. Based on our schedule, it is our tea break. But during the tea break, view, word, see, and banner photo exhibition outside. So happy, I wish you happy breakfast and tea break.